Hello, and this is a presentation on anxiety in our youth by Amanda Schrader. I'm a nursing student at Indiana State University. Learning objectives for this presentation include being able to define and recognize signs and symptoms of anxiety in children, recognize the different classifications of anxiety, understand treatment options for anxiety, and understand how this can affect the student in school, and for parents to be aware of accommodations that can be requested to be made in the school setting. At this point in time, if you could click the link below, there's a pre-test that you can take, then come back to the presentation, and then there's a post-test option as well. Anxiety in children. Fears and worries are normal in children. However, when these fears interfere with their daily activities, such as time at school or playing with friends, it's referred to as anxiety. There are many different kinds of anxiety, including separation anxiety, phobias, social anxiety, general anxiety, and panic disorders. 1 in 5 children in the United States have an emotional, mental health, or a behavioral disorder. And the two most common mental health conditions in children is anxiety and depression. Oftentimes in children, anxiety can manifest into physical symptoms. With children, this often includes trouble sleeping, fatigue, headache, stomach aches. Sometimes the stomach aches can be so severe they cause vomiting. The first category of anxiety I'll discuss is separation anxiety. Oftentimes with children that have separation anxiety, they become very anxious when separated from their parent or guardian. At times this can lead to refusal to go to school or tantrums in the morning prior to school. There are oftentimes physical symptoms with separation anxiety, including stomach aches and vomiting. These children are usually overly clingy, have trouble sleeping. They fear about their safety of the parents or loved ones once they are left. And like I mentioned earlier, they have tantrums when separated from these loved ones. Social anxiety is often seen at school. These children tend to avoid social situations. They fear talking or meeting new people, especially in new situations, so such as the first day of school in a new building. These children often have few friends, and the only friends they may have are relatives, such as cousins or siblings, or children that they've grown up with in a daycare setting. They're afraid of school where they must interact with peers or be called upon in class or have to give a presentation in front of their peers. General anxiety. These kiddos worry about the future, worry that something bad is going to happen, such as a natural disaster, etc. They have frequent concerns about friends, family, or school, worried that something's going to happen to their friends or family. They fear making a mistake, which often leads to a lack of self-confidence. These children often have unwanted thoughts, irrational thoughts that they don't understand. Treatment options. If you think that your child is experiencing anxiety, it's important to reach out to the child's healthcare provider first for direction and guidance. Sometimes physicians can find that this anxiety is caused by something such as ADHD or perhaps a trauma that the parent isn't aware of. Some providers may just recommend having a healthy balance of diet, exercise, and sleep to begin with. Based on the child's age, they can give the amount of hours of sleep per day. Children should exercise at least 60 minutes per day, and they would recommend avoiding processed foods and moving towards more lean protein, whole grains, fruits, and veggies for a more balanced diet. They can discuss relaxation techniques or refer to a therapist. And a therapist may recommend cognitive behavioral therapy, which is common among children with anxiety. The provider may also discuss medication use. Oftentimes, a combination of therapy and medications are most helpful. Cognitive behavioral therapy. CBT is a form of talk therapy that teaches coping skills that help children reduce anxiety themselves. This teaches to replace negative thought processes with positive ones. Children can practice these skills at home as quote unquote homework. The sessions are usually short term and last about 12 weeks, and in this 12 weeks, the therapist hopes to develop coping skills that the child can carry on at home or at school on their own. These techniques include learning to relax one's mind. They may try role playing to prepare for possible anxious interactions and see how the child would react to that. Learning to face fears is another technique that's used. Medications are sometimes used if the provider or therapist recommends. They're often used in combination with therapy. Then can be long or short term. This usually includes SSRIs, which include medications such as Lexapro, Zoloft, Cymbalta. You'll want to monitor closely. Sometimes children or teenagers that are on these medications can have increased suicidal thoughts. So things to watch for would be self-injury, talk of dying, irritability, increased trouble sleeping, or worsening of symptoms. If anything like that happens, you would need to reach out to your healthcare provider immediately. In the school setting, it's important for adults to understand that each child will manifest symptoms differently while in school. Some children will internalize it. Some will show bouts of aggression or anger. It's important for guardians to work closely and reach out to the teacher, school counselor, and or their school nurse to help make a plan. Some teachers may allow for breaks in the class when needed, and a plan for what to do when unable to focus on the work due to anxiety. Flexible deadlines can be beneficial for the students that experience anxiety. And it's important for parents to realize there is an option available called a Section 504. That is a federal statute that must be recognized for all schools and prohibits discrimination for any students with physical or mental impairments. These can include accommodations for anxious students, which can be used for things such as standardized testing. They could have increased test time or pulled to smaller groups for weekly testing, which can help alleviate some of the students' anxiety. In conclusion, anxiety is a common problem among school-age children. There are different classifications that we went over in this presentation includes social anxiety, separation anxiety, and general anxiety. Anxiety can manifest into physical symptoms. Treatment options include therapy and or medications. Parents can work with their school to set a plan in place, including a possible 504. And here on the last slide, I've included the references that were used to make this presentation. If you would like, if you click the link below, there's a brochure attached about anxiety in children, as well as a post test to see what you have learned. Thank you for watching.